Is it time for open enrollment? Not sure how you're going to enroll in today's current environment? We've leveraged our technology platform to make this entire process as easy as possible for you. Voluntary Benefits at Work is here to help you with every step of the benefits selection and enrollment process. You will have the ability to meet one-on-one with one of our highly trained and licensed benefits specialists. Flexible scheduling that allows you to select a day and time that works best for you. You can enroll from anywhere, even in the comfort of your own home wearing your favorite pajamas. Here's how it works. Once your open enrollment dates have been finalized, you'll receive a text or email from VB at Work. This is not spam or junk mail. This is your invitation to schedule your appointment to meet with one of our highly trained benefit counselors. On the day of your appointment, we will call you to walk you through the benefits selection process. We're here to answer any questions about the benefits being offered by your employer. This process should take around 15 minutes or less. Please remember that you must speak with one of our counselors even if you plan to waive all employer-provided benefits.
Now let's talk about exciting employee-funded programs available to you from your employer to provide financial wellness. Family, health, and wealth can all be sidelined with an injury or illness that always comes without notice. Your personal savings can be wiped out as there are so many costs involved with recovery, such as deductibles, co-payments, and even travel and lodging costs that are not covered by your medical insurance. The benefits we will discuss in the next few minutes will allow you to participate in highly affordable, voluntary, and employee-funded programs that will pay you cash so that you can have the peace of mind knowing that you'll be able to financially, emotionally, and physically get your life back on track and keep you from financial hardship in the first place. Life insurance is the cornerstone of financial wellness and is the one premium you pay for to help your loved ones when you pass away. The best time to buy life insurance is when you are young and healthy. There are two types of life insurance: permanent and term coverage. Term insurance is usually inexpensive and covers you for a certain time period, usually 10, 20, or 30 years, and then it expires. Permanent insurance is just that, permanent. It does not expire, and you can carry it into retirement at the same premium. We will help you evaluate which plan fits best with your budget and your family's needs. Life insurance can ensure that your loved ones are taken care of and will provide peace of mind knowing that your affairs are in order. As we may not be able to control the timing of our passing, we can control how those we cherish are cared for when we are gone. Critical illness. I like to call it our living life insurance policy because it allows you to financially survive many critical illnesses by paying you a lump sum benefit for a heart attack, which is the #1 cause of death in the United States, a stroke, which is the leading cause of disability, and a cancer diagnosis, of which the risk of cancer is 1 in 2 for men and 1 in 3 for women. These are just 3 of the main benefits of the policy, but several other benefits are included. You'll be able to purchase $10,000 or $20,000 of critical illness coverage, which would cover you or a family member should you suffer a critical illness.
Cancer insurance. It may come as a surprise to learn that 1 out of 3 people will be diagnosed at least once in their lifetime with cancer. The challenge with cancer is that it can be an extremely expensive and lengthy disease to treat. If a cancer diagnosis ever becomes part of your life, the last thing you should have to worry about is money. Even with good health insurance, it's not uncommon for cancer treatments to cost a family as much as $10,000, $20,000, or even more every single year. Decisions about your level of treatment shouldn't be impacted by your finances. That's where cancer insurance comes in. It can help supply added protection and financial support and allow you the ability to work on the most important piece, which is getting better. The policy pays cash directly to you to cover anything you want, from medical bills and prescriptions, rent or mortgage payments, childcare, and groceries. It can even help cover time off from work or travel expenses associated with cancer treatment. Because you should be focused on the fight, not your finances. You can't predict the future, but you can prepare for it. Let's discuss disability insurance, which is really your paycheck protection program. If you get hurt on the job, fortunately you have workers' compensation to help pay your bills. But actually, the risk is 1 in 4 that we will get hurt off the job or sick. And this means without disability coverage, when you can't come to work, your paycheck will stop. 90% of all disabilities are actually sickness-related and often result in out-of-pocket expenses. And what happens to your bills if you're not working? They continue to keep coming. You've now lost your most valuable asset, which is your ability to make a living. However, by electing disability coverage that pays you a weekly cash benefit, you know that you have protected your paycheck. You will now have the money to pay bills like your rent or mortgage, your gas bill, your phone bill, and even have lunch money for the kids. Also, disability coverage that is purchased before you are pregnant can also cover maternity. Knowing that you have disability insurance, you will be able to focus on your recovery and getting better, keeping you and your family financially secure. Accident insurance is one of VB at Work's most popular plans, as it pays you cash based on the severity of an injury as well as any treatment needed. It's not a matter of if an accident is going to happen, but when will an accident happen. Accidents can and do happen anytime, anywhere, and trips to the ER can be extremely expensive and normally come with extra cost, let alone the physical recovery that's involved when someone does get hurt. None of us plan on an accident, but something as simple as twisting your ankle or even a more serious injury comes with expenses that are not included in your normal budget, and oftentimes this means you are not able to go to work. The cash from accident insurance can help with things like your deductibles and even time off of work if, say, one of your children were injured. Major medical is extremely important, but it is designed to pay directly to the doctors or the hospitals to cover a portion of those bills. Accident insurance is designed to pay you cash when you need it the most, when an accident has happened to you or a family member. Accident plans are great because there are no health questions, no age bans, and costs less than $1 a day. Depending on the severity of the accident, you can receive anything from a few $100s up to several $1,000s, and that cash is coming directly to you to spend as you see fit. Also, children can be covered up to age 26 for everyday accidents and often sports-related injuries.
Hospital indemnity insurance, because life can change in an instant. A sports injury, chest pain, a serious accident, a global pandemic like COVID-19, or even welcoming a new baby into the world could all lead to a hospital stay. No matter what the reason, it can be physically, emotionally, and financially challenging. This is where hospital indemnity insurance can help protect you and your family, because just 3 days in a hospital can cost well over $30,000 in medical bills, and major medical insurance may not cover it all. Even with medical insurance, these costs are often subject to your out-of-pocket deductible. Hospital indemnity insurance pays you an initial hospital confinement benefit and a daily confinement benefit for a covered hospital stay, making it easier to cover all of your expenses while you're hurt or sick.
Identity theft is the fastest growing crime in the U.S. It has been listed as the #1 consumer complaint for 12 consecutive years. Every 3 seconds, someone becomes a victim of identity theft, and it can be financially and emotionally devastating. Identity theft is often costly and very time-consuming to resolve. If you haven't had your identity stolen yet, unfortunately it's just a matter of time, and you probably already know someone who has. Identity theft occurs when someone steals your personal information and uses it without your knowledge to commit fraud or other crimes. Minimize your chances at becoming a victim of identity theft and learn how identity theft insurance can not only help prevent, but also restore your identity should you join the growing number of victims across the country.
Did you realize that 67% of the bankruptcies in the U.S. are due to an unforeseen injury or illness? And over 70% of these people actually had medical coverage? Also, 35% of hardship withdrawals of retirement plans are now a result of emergency medical expense. This is where the voluntary benefit plans can offer financial assistance paying for medical or non-medical related expenses associated with an injury, illness, or death. Your employer wants to be sure that you are covered with benefits that will pay your bills and even time off work, so you can focus on getting the best treatment and recovery possible and get back to doing what you love. The main thing to remember is that regardless if you have the best medical insurance or no medical insurance, these policies are going to pay you cash to spend however you see fit. Now is the time to take action, as open enrollment and eligibility to sign up for the specific programs offered by your employer won't happen automatically. Please know that signing up for financial protection has a limited time frame. Your elections are important because they won't come around for another year. Make this the year that you participate in programs to provide you and your family the financial security that fit your budget and your lifestyle. During this initial open enrollment, remember, there are no health questions for the new voluntary benefit policies being offered. Be sure to get the information you need to make an informed choice for yourself and your family. Thank you so much for your time. We are passionate about these programs and the difference that it makes in people's lives. Let our benefits work for you.